Welcome to this explainer where we're diving headfirst into the medical mystery of halitosis. We're going to separate those short-lived masking agents from the real, permanent cures. I mean, if you've ever felt a little self-conscious after a garlicky meal or woken up wondering what on earth is happening in your mouth, you are exactly in the right place. Today, we're putting bad breath completely under the microscope. Okay, let's get right into the numbers here. 50%. According to the American Dental Association, at least 50% of adults have experienced this universal yet, slightly taboo issue in their lifetime. That basically means if it isn't you, it's probably the person sitting next to you. It's incredibly common, but the crazy part is the root causes are still completely misunderstood by most people. Before we start investigating the causes, let's establish a clinical baseline. What exactly are we dealing with? Simply put, halitosis is an unpleasant or offensive odor emanating from the oral cavity. But here's the absolutely crucial part. It isn't just one single affliction. It can be a totally temporary problem based on what you just ate for lunch, or it can be a really stubborn, chronic condition that lingers day after day. So here is our investigative dossier for today's explainer. 1. The anatomy of bad breath. 2. The usual suspects. 3. The hidden medical culprits. 4. Cover-ups versus real cures. And 5. Solving the non-oral cases.
All right, let's kick things off with Section 1, the anatomy of bad breath and understanding our oral baseline.
Let's start our investigation at the scene of the crime, right? The mouth. Now, we're looking at two massive extremes here. First, there's your standard morning breath. We've all been there. It usually happens because your salivary flow drops overnight, or maybe you're just breathing through your mouth while you sleep. Honestly, it's super easily resolved with a quick brush and a glass of water. But we have to distinguish that from severe dental neglect. This is the other extreme, where accumulated food debris and plaque lead to gingival inflammation or gingivitis and even deeper periodontal issues. Bacteria basically break down those trapped food particles, producing a highly offensive chronic odor.
Moving right along to Section 2, the usual suspects, we're looking at everyday triggers and habits.
So moving beyond basic hygiene, the most common everyday culprits are actually hiding right in our daily routines. Take dentures, for example. If you wear them and fail to clean them every single night, you're practically inviting food accumulation that directly causes malodor. Then there's smoking. It doesn't just smell bad on its own, it literally dries out your mouth like a desert, which compounds the whole problem. And finally, a remarkably simple misstep, just failing to vigorously rinse with plain water after a meal to dislodge debris. It makes a huge difference.
But here is where the biology gets truly fascinating. When you eat strong foods like garlic and onions, the problem isn't just sitting in your mouth. During digestion, your stomach actually absorbs the strong oils from these foods directly into your bloodstream. That blood then travels to your lungs. What does that mean? It means the odor is literally emitted in your breath every single time you exhale. This internal hijacking can taint your breath for up to 72 hours. Wild, right?
Okay, Section 3, the hidden medical culprits. This is when bad breath comes from beyond the teeth. So, what happens when you brush, you floss, you avoid the garlic, and the problem still persists? Well, a massive underlying culprit is dry mouth. You see, saliva is your mouth's natural defense mechanism. It keeps things clean, moist, and directly reduces odor. When you're deprived of this cleansing flow, bacteria just thrive. This dry environment can be triggered by salivary gland conditions, chronic mouth breathing, or even, and a lot of people don't know this, as a side effect of blood pressure and urinary medications.
The investigation also has to move down into the respiratory system. Infections anywhere along this tract can heavily contribute to halitosis. In the upper respiratory area, things like chronic sinusitis, a nasal obstruction, or a nasopharyngeal abscess can literally leak foul odors into your breath. And deeper down in the lower respiratory tract, conditions ranging from bronchitis and pneumonia to severe, serious diseases like lung carcinoma can actually be the source of the smell.
We also absolutely cannot ignore systemic factors. Tonsillitis, and specifically tonsil stones, act as these incredibly potent little traps. They just collect bacteria and emit a terrible smell. Furthermore, halitosis can sometimes be a red flag for larger systemic conditions. We're talking kidney disease or certain blood-borne diseases that manifest as an oral malodor. It's just a fascinating reminder that the mouth is truly a window to the rest of your body. Which brings us to Section 4. Cover-ups versus real cures. We're talking about masking the problem versus mechanical reduction. Now it's time to evaluate our defenses. We really have to differentiate between masking products, your everyday mints, mouth sprays, and gums, and true management. While they are heavily marketed to us as solutions, masking products never actually manage halitosis. Their effect is entirely short-lived. True management requires mechanical reduction. That means physically removing the oral microorganisms and the food they feed on. You literally have to remove the problem, not just perfume it.
So, how do we actually execute this mechanical reduction? Some methods are pretty obvious. Daily brushing, flossing, tongue scraping, getting a professional scaling at the dentist. But here is a highly effective trick you might not know. Eat a solid breakfast. The physical passage of solid food over the surface of your tongue actually acts like a wiper blade. It physically clears away the bacterial coating that builds up overnight. Add in slightly acidic foods to stimulate your saliva, and your body's natural cleaners get right to work.
And finally, Section 5, solving the non-oral cases. This is all about chemical treatments and systemic solutions.
For persistent or non-oral bacterial offenses, basic scrubbing just isn't enough. We have to bring out the chemical tools. When you're dealing with stubborn microorganisms, using mouth rinses with antimicrobial properties, like chlorhexidine or essential oils, can physically reduce the bacteria count. Alternatively, you can use chemical neutralization. Ingredients like zinc, sodium stannous, and magnesium don't just kill bacteria, they chemically bind to and neutralize the odorous compounds themselves, right there in the oral cavity.
But listen, if the halitosis stems from non-oral sources, no amount of mouthwash is going to save you. The ultimate cure here involves treating those specific underlying medical problems directly. This might mean physically removing tonsil stones or even getting a tonsillectomy. It means taking prescribed antibiotics to eradicate internal infections like H. pylori or E. coli. Or it means working directly with your doctor to manage a chronic sinus infection or kidney disease. Basically, if you cure the body, you cure the breath. So, as we wrap up this explainer, I want you to take a second and reflect on your own routine. Are you truly curing your halitosis, or have you just been covering it up this whole time? The next time you reach for a stick of gum, really ask yourself what's happening beneath the surface. Thanks so much for joining me on this investigation into the science of our breath, and keep seeking out those real solutions.